Good morning, Decatur. You joined us last week for a rough outlook on COVID-19 cases in Morgan County. After Monday, we continue to see cases rise. Since we've talked, our community has added almost 650 confirmed cases. I'm so thankful for our two guests today who are working tirelessly to serve our community, and they're here with us. We have Judy Smith with the Alabama Department of Public Health.
Glad to be here.
Good to have you back with us, Judy. And then, of course, Kelly Powers, President of Decatur Morgan Hospital. Kelly, good to have you with us.
Thank you.
Okay.
Thank you.
Know both of you are tired after a weekend where you're not getting any rest. So for Morgan County, we're looking at record numbers in some respect almost daily. Today we have 7,540 confirmed cases and another 952 probable cases. It's a 9.5% increase from last week. In the last 14 days, we've added over 22% of our county's total cases since the beginning of the pandemic. Do you see a pattern of how our numbers continue to rise? Despite the pandemic, we still have other health problems. If you think that you might be having a heart attack or experiencing medical emergency, please do not stay away from the hospital. Take advantage of our local facilities. Don't wait. Our trained medical professionals they're there to help you. They do so with very strict protocols on how they go about that treatment. Yes. The holidays can be tough for many. As we say every week, remember to check on your friends and loved ones, especially our young people and our elderly residents. If you know someone is having harmful thoughts, please contact the National Suicide Prevention Lifeline. Trained crisis workers are available to talk 24 hours a day, 7 days a week. We share this number every week. It's 800-273-TALK. That's 800-273-TALK or 8255. As always, if the situation is potentially life-threatening, call 911. So with that, Kelly, you want to give us an update with the hospital?
I will. I first want to say thanks to all of our Decatur Morgan Hospital employees. Mayor, I am so proud of all of them. Just everything they're doing every day, going above and beyond to take care of our community. We currently have 86 positive cases in the hospital, 10 PUIs, so that's a total of 96 that we're treating as positive. 17 of those are in ICU and 16 are on the vent. Unfortunately, we've had some deaths, so our numbers are down a little bit today as far as ventilated patients, but we were up to as many as 31 in ICU recently. I currently have an overall of 22 in the ICU right now, with 20 on vents and 14 on BiPAP. So that's 34 patients who are on assisted breathing help. Again, it is a very stressful time at the hospital, and I know our nurses, everybody from nurses, physicians, all are stretched, but I just want them to know how much we all appreciate them and everything they're doing. I did want to mention, if you'll let me, I apologize for offending some of the nurses on something I said a few weeks ago about traveling. It was not, I guess, in anything to do with traveling. I know people have to take jobs and get money where they can for their families. It was mainly out of frustration for the ones that are left behind. Because what happens when nurses do leave us and go other places, we have to find other nurses to work there. And, it puts a strain on the people that are left behind. My sister's a nurse, so I'm a nurse advocate. And I appreciate everything they do every day. I couldn't do it. So it takes a strong person to be a nurse and take care of people. So I just want to say I was sorry for offending anyone if I did. Other thing I want to mention, we are working on the vaccine, and I hope Judy will talk a little bit about that, but we are really thankful to be getting some soon, and I have a lot of physicians who are ready to take that vaccination. So if you're worried about taking it, I'm going to let you know how many doctors take it, and maybe have some come up here and take it on the air, Mayor, so that we can really get our community vaccinated when it is available.
Thank you very much.
Thank you.
Appreciate you.
Thank you.
And I know you wouldn't do anything to intentionally offend anyone.
Well, I would hope not.
Yeah. Judy, good to have you back with us.
Thank you, sir.
Yeah. You have an update for us?
Well, actually, I do, and I do have some good news. I feel like Paul Revere now. The vaccine is coming. The vaccine is coming. So I think Paul Revere at least was credited with warning us about the enemy. I hope I'm warning us about the allies. I'm hoping that this vaccine is going to be our allies. And I will tell you that for the first time since this pandemic began, we are beginning to post the finish line. We've got, if you will look as far as you can on the horizon, you will see a finish line. Now, it's still around the curve, there's still a lot of humps, and there's still a lot of hurdles. And we've got to get there. We've got to get past all these to get to that finish line. But there is hope, and in a season of hope, you know, what a wonderful time to have this hope there. But again, we still have huge hurdles, and some of those hurdles have big ditches on the other side of the hurdle bend. And, you know, Thanksgiving, you know, during the course of all this, we've talked about a number of the hurdles, a number of the times, and yet we still have fallen into some of these ditches. We still have failed to accomplish what we needed to do to get to that finish line. Thanksgiving kicked us big time. I mean, it kicked us big time. We talked about our fear before Thanksgiving, and we unfortunately didn't miss any of that. And a lot of our folks, some folks will not go to Christmas with us because of that. And it's just but the finish line is there, folks. We just got to do this together. What's the prize when we get to the finish line? Hopefully we will get our world, our county, our city back to some level of normalcy like we want it. We'll get to have Christmas parades. We'll get together with our family with Thanksgiving. The mayor is already planning a Christmas in July party for all of us. Part of that party hopefully will be a mass burning, although please don't do it now until we tell you to. But we're hoping to get there. So folks, just hang in there. I am going to have to correct something that the mayor said. Unfortunately, while he was giving those numbers, the numbers went up about 200 more. I will tell you that Alabama will cross the 300,000 mark probably within the next day to 2 days in terms of total people who have had COVID. Over 244,000 of those are confirmed. But in Morgan County, we have reached the mark of 7,616 confirmed with an additional almost 1,000 probables. And let me say something about those probables. Most of those are cases is just because of how the data was entered, that it was, you know, we're listing it as probable, but the total is 8,580 cases that are currently added just for Morgan County, not our neighboring counties. I will also tell you in the last 2 weeks, over 50% of all tests that have been done in Morgan County have ended up being positive tests. We have people everywhere. I will tell you that this week, two of my employees lost their husbands. One lost an uncle. You know, this is a terrible disease, and it's chasing us big time. And even if maybe the finish line is in sight, we just simply cannot give up. I will also say that we in Morgan County now have 64 deaths. You know, and I'm reminded at a time around Christmas or any other time when Barbara Walters interviewed Norman well, I can't even say his name now. At one time about the Gulf War. And one of the questions that she asked him was, she said, "Are you glad that there weren't any more boys that died than did?" And his profound answer, which I would say to you today, one is one too many. One more is one too many. And my heart goes out to us, but it certainly goes out to Kelly and the hospital folks, and we understand the frustration. You know, the hospitals are overwhelmed across the state. Decatur Morgan is overwhelmed. Our neighboring hospitals are overwhelmed. This week we had an issue about somebody that needed to be transferred to a higher acuity level hospital. The hospital couldn't take them because they simply did not have the ICU beds to do this. Folks, we've got to get in this together. We've got to do what we can do. The finish line is now out there. We can get to where we need to be with the finish line, but we can't give up right now. We need to take our families and we need to go as far as we can across those hurdles to get to where we need to go. I will tell you that I want you to visualize this. Someday, there will be a movie about all this. And one of the things in the movie, I hope they ask me to consult, and I certainly hope they get a very attractive person to play my part, but aside from that, you know, there will be a movie, and one of the things in the movie is there will be this invisible film that wraps itself around folks, and it has three talents that it really likes. One of the things is, in order to go from person to person, it's got to be close. As a country girl, growing up as a country girl, some of you all won't remember this, but and we'll have to look it up, but there was a thing like cocoa burrs that we had when we were in the, and what you did is when you walked around, you could get the cocoa burrs, and you would get home and you'd have cocoa burrs all over the legs of your pants because it had jumped on you and you had no idea that you had even walked through them. The same thing is true. If you look at the picture of the COVID virus, it looks very much like a cocoa burr. And what in this invisible film, there's going to be all these little cocoa burrs that are going to be, and it loves get-togethers, absolutely loves get-togethers because it can jump from it doesn't jump, but if it can reach from one person to another. And so if you get close enough, you're going to get the COVID cocoa burrs. You're just going to do it. The other thing it does once it gets you is it loves to go in your nose and your mouth. And one of the first things that it does is it does away with taste and smell. And so that tends to be one of the major side effects. Now, one of the things it can't do, that it doesn't do well at all, is go through barriers. So if there is a mask on, if there is any type of barrier, then it certainly cuts down on the opportunity for that invisible virus to go there. One of the other things that we know that it loves is we know that it loves weakness. The older you are, the more likely the cocoa burrs, the COVID cocoa burrs are to get you, the more likely you are to get really sick from them. And if you have other health issues, then certainly it attacks you there. So over these next holiday days, and there's nothing we can do about Thanksgiving except try to get through it and try to do better. But over these next days, as you're around folks, your number one defense in all of this is distance. If it can't get to you, it can't do anything to you. So your number one defense is distance. Even if you're at home with your families, and most of us know we're not going to wear a mask when we're eating Christmas dinner with our families, but distance as much as you possibly can. But I want you to visualize that everybody there has this little invisible COVID cocoa burr necklace on that's around them, and do the best you can to stay apart. Also sanitation, that's another thing that you still can do during the course of all this. So guys, we've got to get over the hurdles so we can get to the finish line. Now, let me say briefly about the vaccine. We kind of, at this point, when most of us were growing up, we had a 4-H club. Currently, as far as our vaccine planning goes, we have a 4G clubs. We've got to have enough vaccine. Right now, we have vaccine coming in. It will come in piecemeal. It is an allocation that is coming in for, based on population and based on where it needs to be sent across the nation. But the first G is to get the vaccine. The next G is to give the vaccine. Now, as most of you know, the first vaccine that comes in is supposed to be intended for those that we have got to keep on board to take care of us. That is our frontline healthcare workers and our first responders. And so the first vaccine will go to those folks. Now, in addition to that, I will say that an additional portion of that is going to go to our long-term care facilities, because what we have known in the course of this is that our long-term care individuals have represented 6% of our cases, but they have represented 40% of our deaths. And so once again, when we talk about the COVID cocoa burrs getting the weak, these are the folks that it has been after the most. So the first vaccine, the second piece of giving the vaccine is, I've got to get Kelly's nurses healthy. I've got to have them here, and I've got to have them available. Our folks are already, both in all healthcare facilities, are already tied up with testing and taking care of folks. We can't turn that loose in order to do vaccinations. And keep in mind that once we give one vaccination, we're going to repeat that again in 3 weeks. And we're going to be giving new vaccines, new first doses, as well as second doses. We've got to have our nurses, our medical staff on board, healthy, and able to do that. Then the third thing that we're going to have to do that's in our planning session, our third G, is that we're going to have to gain people's confidence in this vaccine. We're putting out a lot of information about, there's been a lot of research done, we're putting out a lot of information about the vaccines, And I'm just going to tell you that I am a child. I know y'all find it hard to believe this, but I'm a child of the polio era. And I remember when polio vaccine came out, and there was 2 different types of polio vaccine, and people were afraid of it. And I'll be honest, one of the types was actually a live virus type, and people were terrified that it was going to give them polio. Neither one of the vaccines that are, one has been approved, the other one is almost approved. Neither one of these are live virus vaccines. Both of these have gone through the stringent FDA studies that are required to get to where we are. You know, we talk about how long it took vaccine to be approved a number of years ago. Listen, folks, a number of years ago, we didn't have computers, we didn't have email, you know, everything went by snail mail. There are many reasons that this has been able to be accomplished a lot faster, not the least of which is our people are in trouble, and we've got to do something to take care of our people. But one of the things that we want, again, the G is we need to gain cooperation until we get there. And then we need to gain confidence so people will be willing to take the vaccine. And then the last one is that we will gain our freedom again. We will gain our freedom to be able to have our Christmas parties, our Thanksgiving party, our mass burning in July, or whatever we're going to do. So that's kind of where we are right now. Certainly at any time we would be available for questions. But to go back to the race, I do want to say this. There's not a coach on the face of the earth that would tell his runners, that would tell his team members, okay, we're almost getting to we can see the finish line, let's slow down. What he's told them is pace it, pace it, pace it. But when the end is in sight, that's when you really put it in gear. You really push, you go to the finish line, and that's where we are now. We're getting the vaccine. Let's do what we need to do to take as many of our citizens as we possibly can to the finish line with us. So thank you, Mayor. Thank you for allowing me to be here.
Sure, thank you. We always appreciate you being here. I gave you the wrong Schwartz. It was General Norman Schwarzkopf.
That's right,
Yeah.
that I couldn't say, but you know when you get over it.
And then last week, I was just looking at the data. We had 54 deaths at this time, and now 64. So,
And one is one too many.
yes, ma'am. Yes, ma'am.
One more is one too many.
So, do we have any questions?
Judy, I'll start with you. I got a couple, if you want to give short responses. First, you say, obviously Thanksgiving numbers are turning out to be bad. How big is your concern for Christmas gatherings?
The same, unless people, you know, we could change it. We have the opportunity to change it. Now, I will say, and I don't know whether it's because of the Thanksgiving numbers, but I have seen more people in masks. I have seen people however, I've also seen crowds that were larger. So, you know, obviously there will be a concern. You know, we've demonstrated every holiday has kicked us. Every holiday, and we just cannot do this. You know, and I will say there's a little poem anyway that says, of all things great and fine, dear Santa, please let us be here next Christmas time. Let's take everybody with us to be here.
Last week, Governor Ivey said that Alabamians were doing a good job combating the virus. What are your thoughts on that statement?
You know, I listened to the thing, and I don't really know what she was, I don't remember that specifically and what she was relating to. I think that she really knows that hospital people are going over and above to do what they need to do. Healthcare workers in our arena are going over and above to do what they need to do. And what she really needs us all to do is she needs us all to get on board. Listen, we still have businesses closing. We still have people hurting. We still have, you know, and obviously, you know, our hospital numbers are terrible. And I think what she's saying is that our healthcare providers in this state, our officials in this state are doing everything they can to keep the message out there and push as hard as we can to get to the finish line, to get to the goal.
Where do you think the spread is happening, specifically here in Morgan County? Are you seeing people still go to church? Is that a concern for you? Box stores? Where do you think it's coming from?
All of the above. All of the above. Now, I will tell you that over and over again, we have not been able to pinpoint a single entity. And you know, you may have some churches that are doing great and others that are not. You may have some box stores that are doing great and others that are not. You know, and literally it is community spread. I will tell you, it is also birthday parties. It is also weddings. It is also let's get together. Now, most folks have done a little better about Christmas parties this year, but there are still some, and it's okay to get together. Just please be careful and remember, your number one defense is distance. If the COVID cocoa burrs can't get to you, they can't get on you.
When do you think the vaccine will be available for the general population here in Morgan County?
Probably in early spring. But, that's not all bad. Number one, it will allow people to watch and see what's going on. It will allow us to have our healthcare workers and our first responders vaccinated, and it will allow us, quite honestly, if we got enough vaccine for the entire community today, we don't have the nursing staff to do it. And we can't walk out of the hospital and out of the public health system and quit testing and quit taking care of people just to give the vaccine. Now, honestly, we wish we could. But we right now cannot do it. So it's a blessing. The other thing is we are so thankful that so many providers are signing up, pharmacies, urgent cares, medical clinics. We will never do it without everybody.
In Morgan County and a lot of surrounding counties, we have a very, more maybe rural populations than some states and areas in the country. Are you concerned about rural communities being able to have access to this vaccine?
Absolutely, but that's also part of our planning process, is to see where we need to go and how we need to do this to make it available. Now, Jenna, I am going to add one thing to that. Most folks manage to get to the big box stores. And so whatever we need to do, people tend to come to town. We're going to encourage them to come to town for the right reasons. When they come to take their Christmas gifts back, we're going to try to give them a vaccine. Thank you.
Questions, Kelly. I know that we had talked about expanding the Parkway location. Where are you at with that? Are you still seeing, the struggle of hiring staff that you have been seeing?
We are. We had some in orientation this morning, so I'm thankful for that. Nurses, techs, housekeeping, all that. And so we're trying to expand and still looking for some positions. So any qualified nurses that would like to come work at Decatur, we need them. Also, physicians, so we're working on that. And I did want to thank the retired nurses. I mentioned that. We've had at least 3 come back out of retirement to work, so I'm so thankful for that as well.
Is there any sort of incentive, new incentive to get people into the building to start working and caring for patients?
Yes, on our COVID unit, we are paying, and I can't remember the exact amount, but yeah, we're paying a bonus and we're paying that top dollar per hour to get them to work there. So yes, we do.
Talk about how important it is to get that nursing staff in. I mean, you guys have 17 people in the ICU with COVID. That's the most patients in the ICU that you've ever had. I mean, these nurses, it's going to get to the point they just can't handle it anymore.
Right, that's right. So we need nurses to work to help with the ones that are tired. They're all taking extra shifts, and we're paying them bonuses to work extra shifts, which is great. But at the end of the day, they are tired, and they just, at some point, money doesn't matter anymore. I'm worn out, so I don't want to, work anymore. So yes, we need more staff.
Again, so 16 patients on the vent. Last week, it was 11.
Yeah.
Same question. Are you seeing this virus get worse, or are you just seeing, you think more people are coming in, more people are on the vent?
Well, I think as Judy said, we see the numbers go up, and it's just a trickle effect. The more people get it, the people that have the health conditions that make it worse, they come into the hospital, and then they end up in ICU and eventually on the vent. And it's just a common theme as we see with this virus, that the people that have those conditions, the outcomes are usually not good for them.
50% of people on the vent, I know that we've talked about this, end up dying from COVID. You said that you had deaths in the past week. With 16 patients on the vent, those are not good odds. Are you anticipating, these deaths, unfortunately, to continue to rise?
Yes, I am. I think that's the sad thing we're seeing. One of our physicians told me to come on here and tell everybody, as Judy said, the people you saw at Thanksgiving, you might not see at Christmas. So people need to take that serious, that especially in the elderly population, the people who are diabetics, other health conditions, when they get this, Jenna, it is serious. And I've seen too many families walk out, and not being able to see their loved ones anymore. It's sad.
That's kind of my next question. Obviously, the ICU, intensive care unit, means these people are really sick. So you said 22 people in the ICU total, 17 of them with COVID. How seriously ill are these patients, and how hard is it for your staff to treat this illness right now?
Oh, it's very hard. I walked through there yesterday. It's hard for anybody that wants to walk through there. You know, you just feel this overwhelming feel of death, you know, when you go through there, because every patient was on the ventilator. You know, I remember the days when we just had a few patients on the ventilator in the ICU, and now when every room is on a ventilator, you know, it's definitely, somebody told me the sound of the machines running, you know, just reminds you of death, you know, that these patients are not going to make it. And it's not just here, it's everywhere. You know, every hospital is dealing with the same exact thing.
How close are we to surge plans? We talked about this last week, you guys opening up additional units, but obviously staffing is an issue. You know, I guess my real question is, how close are we to that BBC opening and becoming a mass hospital center?
Oh, we're already a little bit past that. We had all of our med exec committee, all our physicians came in yesterday to the hospital, and our leadership team, and we worked through different strategies on where we're going to put patients. We had the 3 South that we wanted to turn into an ICU. Huntsville worked with us, and we turned it into med-surg today. So we've added 12 beds there, med-surg, but that will let us put ICU patients on PVC. So we're already doing that, and just as they come through the door, figuring all that out.
Any other message that you have to people at this time?
You know, again, I just say this, just reiterate from Judy, you know, wear your mask, social distance, Zoom with people, you know. I don't want to see what happened after Thanksgiving happen again at the end of December and toward the 1st of January, so that, you know, you have Christmas lunch with your grandparents and then they're no longer here. So please help us with that. You know, and as Judy said, just give us another 6 to 8 months and we can get through this thing, you know.
Thank you.
Thank you.
You know, Jenna, we've been placed in positions of leadership, and we're thrilled that we're able to do that. But to sit through these press conferences weekly and hear the news it's delivering is kind of tiring and wearing, even on us from an emotional standpoint. So to think of our healthcare workers and then families that have lost loved ones, not able to grieve like we're used to grieving, having to do it with graveside services, things of that nature. Big change. I wish I could say that last week wasn't a rough one for the entirety of North Alabama, and I wish that our hospitals system wasn't inundated with COVID-19 cases. Reaching new records on inpatient care is almost a daily thing. Wishing doesn't get us anywhere, but I do know 3 things that do. That's wearing a mask, social distancing, sanitizing. This week, mask up, Decatur. It's in our hands to turn this around. And then we have one more question from Channel 19.
Hi, Lauren, you still with us?
Yeah, I'm still here.
Okay, please proceed with your question.
Okay, perfect. Hi, everyone. Good morning. This is Lauren Harkson with WHNT News 19. I was wondering if we have any idea how many COVID-19 vaccines we'll be getting in Morgan County, if we have a number.
That allocation has not been totally determined at this time. We should have those numbers within the next couple of days.
Okay, perfect. And then,
I'll add
do we
to
know
that.
once it actually hits the public, I think you said in the spring, will it be kind of like a first come, first served basis, or will there still be an order depending on age or job or anything like that? Do we know yet?
Once we get to the general populations, once we've worked through the initial phases in this, then we'll have, the anticipation is that we will have some of both. Some of it will be on a first come, first served basis. Some of it will be on an appointment basis. Right now, one of the critical things in this is that it comes in, the Pfizer comes in a 5-dose vial, which has to be thawed. The Moderna vaccine comes in a 10-dose vial that doesn't have to be thawed. However, we cannot afford to waste any of this vaccine, so we don't want to get to the end of the day and have a 5-dose vial and only 3 people are there to take it. in a walk-in situation, or even in an appointment situation and somebody doesn't show up. The Moderna vaccine is exactly the same way. And I will tell you, it is very complex in, the ability to make sure that we utilize the vaccine wisely. We make sure that we get the second doses in there. But right now, in the planning process, there's some of both. Some appointments, some, take as many as we can for that day, and some walk-in clinics. So we're planning for both.
To your first
Right
question,
now, the focus is really just to get it to those healthcare workers and those first responders, right?
What was the first part of the question?
Can you please repeat that, Lauren?
Yeah, I was just making sure that the focus right now for the vaccine is to give it to the healthcare workers and the first responders.
That is correct. That is correct. We've got to keep these folks in business. We've got to keep them going. The hospitals and medical facilities are already strapped to have folks available, so we've got to get these folks protected so they can continue to provide care.
Lauren, Ms. Powers with Decatur Morgan Hospital would like to respond to your first question.
That's perfect.
I just want to say, Huntsville and Athens are getting some of the first doses this week,
And Coleman.
and Coleman.
And Coleman.
But Huntsville and Athens are going to share them with Decatur. So we hope to get maybe around 300 doses this Thursday or Friday to vaccinate our physicians and our frontline staff. If that answers your question.
Hey, Kelly, let me add to that. We can't even vaccinate. If we had enough vaccine to vaccinate all of the first responders and the nurses, we couldn't do them all at one time anyway. There is some evidence that there are some at least mild side effects, some sort of flu-like symptoms. We could not give every nurse in the hospital, if we had the vaccine, give her first vaccination and then potentially have people out the next couple of days, the next day and the next couple of days. So that's a huge part of the planning process also, is what is the impact when we give the vaccine.
Perfect. Thank y'all so much.
Thank you, Lauren.
Thank you for joining us today. Our next press conference will be Monday, December the 21st. It'll be 1 hour later at 11 o'clock following our city council meeting. Then we'll be back this Friday at 3 o'clock with Decatur City Council Representative for District 3, Carlton McMasters. So hope you'll join us then. Thank you. Thank y'all.
Thank you.
You're very welcome.